As far as the influenza report goes for this morning, I think the bottom line is that there's still a lot of influenza activity out there. There are some areas of the country that are showing some decline in the percentage of people going to their doctors for influenza-like illness, and there are some areas of the country that aren't showing this decline, that are showing lots of activity. We're right in the middle of influenza season, and we expect high levels of activity for quite some time yet. As far as different measures of influenza activity, there are 47 states reporting widespread activity this week, and that is an increase compared to last week. There were 41 states. Another measure of influenza activity is the intensity of activity, and right now 24 states are reporting high activity, and that is a decrease actually from last year when 29 states in the country were reporting high levels of activity. Influenza hospitalizations is something else we keep track of, and that number, that rate, I should say, is increasing, and we expect it to increase for some time. Children are one of the groups that we identify as being particularly at risk for severe illness from influenza. That's why we keep track of the number of children who die every year with influenza, and sadly, that number has not been zero since we've been doing this kind of surveillance. There were 2 children reported this week to have died with influenza, and that is an increase, brings us up to 20 for this year from 18. It's always unfortunate when anyone dies from influenza. We pay special attention to children because, as I said, they are at increased risk, and we target a lot of our prevention messages, such as vaccination, such as antiviral use, and other things toward that group to prevent any complications, particularly death in young children.